Welcome to today's show and tell. My name is Genta. I'm Program Manager at LOTI. In today's show and tell, we'll be hearing from Eden Monroe from Hackney, who's been leading the Connecting People Remotely project. This project was funded by LOTI as part of our wider work on exploring the potential of assistive technologies to support boroughs' COVID response, more specifically by supporting isolated individuals to live more independently. Saying that, we have done a lot more work in this area, mainly focusing on helping boroughs make evidence-based decisions about the role and effectiveness of different ATs and to conduct their AT trials. And you can find out more about all of this on our website, loti.london. But for now, I will hand over to Eden.
Thank you so much. Thanks everyone for joining. And just to give you a bit of a background about what this is, what we're actually talking about, the Connecting People Remotely pilot was aimed at people with social care needs or on their GP's learning disabilities register, experiencing social isolation and also digital exclusion. What we did was this short, small-scale pilot where we gave them an iPad to keep. We lent them a SIM card for data for 6 weeks, and we provided them with some guidance on how to use the tablet. And critically, we also got some fantastic help from Riverside Engage Hackney and Age UK East London to provide people with one-to-one support as well, so that they could get up and running with using the device. The aim was really to help them get in contact with other people and reduce that social isolation in a way that they might not otherwise have been able to. So that's what we're explaining today. We're going to tell you all about how that went. It's worth mentioning we've got quite a lot of content in the slides. So I'm going to be skipping around and skipping over a few things. The slides will be shared, and we also have resources from the pilot that will be made available. It's going to be all publicly available, so feel free to share it on with your colleagues and obviously your family and friends as well, if they want to know what we've been up to and how the world of assistive technology is developing. This is part of the AT programme at Hackney, which is broadly looking to empower residents and carer to empower to manage their own lives using AT. But it was not just a Hackney-led affair. We had a lot of partner organisations working with us on this. And so I'll hand over to Kat to pick up to start.
Thank you, Eden. Yeah, so in terms of, I guess, one of the key things that was really good about this was kind of the joint working that we did. So in my role, I'm joint across Hackney Council, but also the CCG, it was City and Hackney CCG at the time, now North East London. And as part of being in the AT group, I was already looking at trying to do something quite similar for, as Eden was saying, adults with a learning disability that are not known to social care. And so when it came about that we were looking to work with LOTI on this for social care, we decided that it would be really useful to join up. So that was the first thing. And then we also did some work with our voluntary sector and put out a bit of a call for support because we knew that we wanted support to be part of this offer. So that's where we ended up working with kind of Age UK and Riverside and Family Action as well. So yeah. And so yeah, I think we've talked about that. So we've got some of the pilot were funded through personal health budgets. So that was the CCG part of the cohort. So this was about using some money to help people get access to technology where they were already excluded from that, particularly as part of our COVID response. We had capacity for 15 people in total, and we started to outline some of the reasons and the rationale for this. So the costs of not intervening, and I won't go into this in too much detail, but it's some of the things about day opportunity services were closed and people weren't able to access the communities, but didn't have devices to be able to join some of the remote sessions that were going on. And we knew that there was a lot of people at risk of loneliness and having a negative impact on their mood, and then the long-term effects of that are sort of outlined here. And again, this just talks about some of the benefits that we would hope to realise through doing something such as this. So some of those things about making access to services, day opportunities, and reducing hopefully the need for care for some people. However, obviously, what we would want to do in a thing like this is a sort of large-scale randomised control trial, which isn't feasible with what we were able to do at the time. And so we decided to run this exploratory pilot with a small number of individuals so that we could just test this approach and understand from it what parts, if all of it, none of it, were effective and scalable. So we had learned from some previous device rollouts prior to this that people often needed support to use the device, and actually just sending devices out to people wasn't necessarily all that was required. So we wanted to make sure that we had that support offered with it, which was why we kind of did it in this controlled way.
Thanks, Kat. Yeah, so our hypothesis for the pilot, what we're actually testing here, is up on screen. As I mentioned, we're providing a device, an internet connection, written guidance, and the offer of one-to-one support to help some socially isolated individuals with medium-low digital skills make contact with others remotely. Nice and snappy, but we wanted something that kind of clearly articulated what it was that we were actually looking at here. And in terms of who we were targeting, obviously, an iPad, a tablet is such a kind of generic device that so many people could find different ways to use. We did focus in on the socialization aspect of that, especially because we were thinking about this as COVID response, and as we're doing right now, we're interacting remotely. So we kind of defined an eligibility criteria based around that, and also trying to target the intervention to people who wouldn't be able to access it otherwise. I will talk a little bit more about how that worked, and I'm happy to kind of go back to that and any questions, but that's just to flag that there. And we work with practitioners to develop that, and also to try and review people's eligibility for that alongside. So from somebody taking part in the pilot, from their perspective, they would be contacted by a practitioner first off, who would explain the pilot in broad terms and ask if they were in principle, if they were up for it, basically. If I'm happy to go ahead, then I'd then receive a more formal kind of document in the post which explains the terms of the pilot. So that covers things like explaining that the iPad is mine to keep regardless of what happens, but the data is going to only be lent to me for 6 weeks, and some of the things around that, and what we're asking in terms of participation in qualitative surveys and things like that. Then after this point, Winston will give them a call, and we'll hear a little bit more about sort of what the findings from that were. That I will do a baseline interview, discuss kind of what my situation is and what I'd like to achieve with the device. And at that point, we'd also kind of just reaffirm that I'm happy with the terms of the pilot. So one of the things I can come back to, but this pilot used LOTI's template plain English user agreement to handle the kind of consent stage of the pilot. And one of the things we wanted to achieve is to do that without having to have a back and forth of written documentation and signatures and stuff, just to have a more streamlined kind of onboarding process. And I think broadly that worked pretty well. At this point, once I've completed the baseline interview, I'd receive the device in the post, and there's a guide with some written instructions on how to get started with that. Specifically, we included step-by-step instructions for how to get onto Hackney's digital skills webpage. And that was another project that was run to produce content, really kind of basic fundamentals of using the internet, explanatory videos. So we thought that could be a helpful kind of springboard for people if they're learning this new skill. We weren't ever intending that the instructions by themselves would be kind of sufficient to get them going. If there are people who want to have support from a support worker, some people had carers who were on hand to help them with that, but they would be involved in kind of taking them through that process. It's up to participants what they do for the 6 weeks whilst while the pilot's sort of while it's running. We did give them some prompts about the things they might want to do, and some goals for the pilot, but really it's up to people what they do. And at the end of the pilot, The idea is that people would return their SIM card to the council. That didn't happen in a lot of cases. We'll come into that in the lessons learned. But then there'd be a follow-up interview, again, conducted by Winston, just to compare the kind of baseline and see how much people were able to achieve in that short period of time. So we had 14 people on the pilot. We were able to follow up with 9 of them afterwards. 6 people had used the iPad to some kind of significant degree, and we got some more insight with them about kind of how they used it and what they were able to do. A few people who were unable to get going with it, they didn't feel they had the support they needed. And there was one individual who was just from their personal circumstances unable to get going. They're still going to kind of effectively do the pilot, but we're not going to be able to evaluate it in the same way. And there's the last few people who we weren't able to get in contact with in terms of the project timelines. We're still going to follow up with them afterwards though, but in terms of today, that's TBC in terms of how they got on. So if I can hand over to Winston just to take us through the findings.
Okay. So these are the list of baseline questions that we asked the participants. The questions are about their hobbies and their general well-being. After 6 weeks, we asked the follow-up group the same questions in order to find out if being involved in the pilot would have an effect on the results. Broadly speaking, there is not that much difference between the baseline and the follow-up group results, especially when you take into consideration the difference in sample sizes. A couple of interesting points to include, however, is that people felt more anxious in the follow-up group. But even though they felt more anxious, interestingly, they had a more positive outlook for the future overall. Another interesting finding is that there is a decrease in the number of interests carried out which were individual. This may be due to the fact that lockdown measures have eased. Having the iPad could also be a factor, but we don't know for sure. We would have to do some more research. Next slide, please. Yeah. So we also wanted to identify the participants' digital literacy using a digital inclusion scale, which is a 9-point scale measuring the different levels of digital capability. We asked the participants some general questions about their internet habits to determine a score based on their answers. As you can see from this scale, the levels range from 1 to 7. We were not expecting to have so many sevens. Some of these questions were answered by the carers on behalf of the participants. So initially we thought that perhaps maybe the carers were inadvertently being over optimistic, which could have been a reason why we had so many sevens, but that was not the case. One of the questions we asked the participants is, are they able to use online shopping or online banking? If they said yes, we would typically give them a 7. But it transpired that although these people, they can use online banking and online shopping, it transpired that they couldn't set it up themselves. So a better question would have been to ask, are you able to set up online banking or online shopping yourself? That would have been a better question to ask to give them that score. Next slide, please. So with the follow-up group, we asked the question that way around, and so this was a more realistic diagram of the digital literacy. Basically, there hasn't been that much change. There wasn't that much change in the 6 weeks. However, one participant who did not use internet at all before, and now they have been using the iPad. So one person's digital literacy definitely did go up. Other than that, there hasn't been much movement in the digital literacy. Now we're gonna have some feedback from the 6 participants who, yeah. Okay.
Sorry, skipping around the slides by accident, sorry.
Okay, so we asked the 6 participants that we did get back, that we did get follow up with. We asked, are you able to use iPad by yourself? All of them were able to use iPad by themselves. 83% have used it. How many times a week using an iPad? 83% said every day, and for various different reasons. For example, one participant uses it for watching movies and films. Next slide, please. We asked if do you use your iPad for activities that involve others, including friends and family? 83% said yes. One participant said I talked to my sister. It's been great being able to see her. The iPad has enabled me to keep in contact with my friends and family. This is actually the main reason why most of people were using the iPads, was to communicate with their friends and family. That's the main reasons for why people have been using the iPads. We also asked, do you use the iPad to attend online groups or clubs or faith groups? 66% never did, but some did. One participant said that they have been helping out brownies and guides on Zoom, which was good. They've been able to use Zoom to go on brownies and guides. And all of the participants, though, even though they hadn't been on online groups, they said they would have liked to. So that was good. Even though they hadn't, they did say they would have wanted to. How often do you receive support? 50% sometimes receive support. 50% said it was easy to use support, various different methods. Some person said it's very easy because your telephone number was provided with the paperwork. Another participant said that they can ask their carer to give them support.
Thank you very much, Winston. So outside of what we learn in terms of what people were able to do with the pilot, so obviously it sounds like some people were able to do kind of what we hypothesized. So in that sense, the hypothesis was proved. Some people were able to use the device to connect with other people, and it sounded like that meant a lot to some of them in particular. We also learned a lot in terms of actually delivering this pilot, both around kind of the mechanisms of evaluating it, and also if we were to scale this up, so thinking about it more as a service that the council might look to provide or facilitate in the future. We've got a lot of lessons learned, and I definitely want to leave some time for any questions, so I'm just going to pick a few out. Firstly, I think there's the engagement side of things. As you can see, we didn't manage to get everyone to complete a follow-up interview at this point, and we are going to follow up with people who we weren't able to get in contact with. But I think it kind of just speaks to the project deadline versus life situation. You can't always necessarily get people to work around the timescales that we had set. But nevertheless, in terms of this pilot, the feedback that Winston's just gone through on the kind of the qualitative kind of thing, as Penny's pointed out there in the chat, that does give us some insight, and especially for a pilot of this kind of scale, when we're only talking about a few people, that gives us the insight that's really helpful here. Another thing just to bring out is generally, I think if I had to pick out a running theme for where things might improve in future, would be around communication between all the different partners. So I think while it was a massive strength that we had so many different groups involved, and everyone was delivering things according to their specialism, was fantastic. I also think it might mean that we missed bits of information that if we had a kind of a more a bit more of a kind of a clearly defined feedback loop, and maybe kind of regular meetings with the one-to-one support workers, we might have picked up on some of those issues earlier on and some of those key bits of feedback.
Yeah, thanks, Eden. And then in terms of like the referrals, I guess a few things that we learned through that, we had like a two-pronged referral approach. One, because of sort of we didn't know how many people might be interested in something like this, and we didn't want to promise something that we weren't going to be able to send to everybody. So we did sort of an initial scoping, working with practitioners and GPs about who might benefit from something like this. So we had kind of like an anonymous initial referral, and then we met as a group to talk about which might meet those eligibility criteria, and then asked for a second referral following sending some information out for people to have a look through, and if they were happy to be involved, then actually sharing kind of who they were so that we could ask Winston to get in touch with them. So it took us a while to find participants, and I think longer than we thought it would. And then once we did get through that stage of sending out the information, there was a few people that then sort of declined and said they didn't want to be involved. And I think having that initial referral process meant that we did have a bit of a backlog or a waiting list, if you like, that we were able to call from. And I think if we hadn't had that, then it might have been difficult. And I think we would have had quite a few of the original 15 kind of not wanting to take part for various reasons. We also noticed that, and we know a lot of people need devices at the moment, and they didn't necessarily fit our eligibility criteria. So there was people that were made that initial referral for reasons outside of kind of that social care element, or people that were on a learning disability register. And also some referrals we had were with people, I think when Winston was making those conversations with people, it was people that did have devices but maybe didn't have the support they needed to use it. And so, you know, it wasn't suitable for this pilot because we wouldn't be sending them an additional device. Again, and then just the communication. So again, we did send a lot of information out to people, try to make sure, and we've got the resources at the end, but just trying to use the same terminology. So rather than device, saying iPad. And when we're trying to talk about data and consent, and then talking about data and an internet and things like that. So I think we've tried to get everything kind of clear into consistent communications, but I think between us, just kind of keeping the referrers up to date with what was going on with the people that they'd responded to, or put forward for the pilot, so that they knew kind of where people were in that pathway and how we then can feed back at the end to those referrers as well. So
thank you. Just to feedback quickly, the way that we provided an internet connection for participants was we lent them a council SIM within the iPad itself. It was sent to them sort of ready to go, which was good. I think that was quite a low barrier to entry for people, which was a pro. We'd initially wanted to give them data only 4G SIMs so that there was no kind of commitment on their side in terms of paying a contract, and they could just kind of, if they only use £10 worth of data and then that was it, then they're not tied into anything. We weren't able to do this just because of the legal side of getting people set up and signing contracts. So I'm in the process of writing this up as a bit of a case study that LOTI are going to disseminate, but we will share how we did this, and we'll share the resources for if anyone in other councils does want to share kind of council SIMs and work in this way. It was kind of successful. You know, we were able to run the pilot, people used the internet. In terms of recovering that has been very, very difficult. Unsurprisingly, really, we kind of knew this was going to come back to bite us, but we kind of did it as a workaround in absence of being able to get them set up with their own kind of internet connection. So in future, we would prefer to kind of involve one-to-one support in that process of getting people set up. I would just pick out some support from the one-to-one support providers. So I know we're very close to time here, so I'll run through it quickly. But Engage Hackney, who did a fantastic job of supporting people, they one thing that they flagged was they had lowered caseloads of some of the one-to-one support workers in anticipation of setting somebody up with a device and kind of working through some of the tasks with them. When there was a bit of a time lag on our end in terms of that referral from the practitioner, getting the device sent out to them, all of that kind of thing, completing the baseline interview, all of that process, which would be reduced if it was kind of a scaled up service, I'm sure, but that had kind of implications on their workload because, you know, then there was nobody to fill up that time. So again, just having that really structured process is really important. Also, in terms of engagement, one of our eligibility criteria was that we wanted people to be actually willing to use the device and engaged in it. But ironically, Engage Hackney reported back that this wasn't always the case, actually. and that made it really hard to support them to use the device because they weren't really that bothered. So that's an interesting one to think, if this was to be repeated or scaled up, how we kind of assess that. It's a really tricky one to kind of pin down. It might have to be something where we make people aware of it, and maybe they sort of self-refer as well. In terms of scaling up as well, we did talk about managing demand. I don't know if Kat, if you want to come in on this point.
Yeah, just in terms of that, the one-to-one support, I think that was one thing that we came into this not knowing anything about, and wanted to get that learning and make sure that we had the capacity within those services to support if everybody needed support for the whole 6 weeks, being kind of that worst case scenario. But I think for scaling up, again, we haven't got enough information about that. And I think one of the things we're thinking about is maybe having sort of a certain limit of capacity. And one thing we learned from kind of the people that were having the iPads is that as long as they were updated as to what to expect, everybody was quite happy with that. So if we had sort of a capacity limit, that it might be, you know, say 5 people at any one time, and then there's a bit of a waiting list and it moves, is probably the way that we would do that if we were going to scale it up with the support attached.
Fantastic, thank you. And yeah, just to say, in terms of the logistics and what was required in terms of the overhead, we kind of took on that role throughout the pilot period. It's not something we could pick up as part of our roles going forward, but did feel that this could be dealt with in a telecare service. And that was also partially because we gave people devices, so we didn't take on that responsibility for maintenance. We picked them up as refurbished devices as well, so that kind of reduced the cost a little bit, just to flag that. So just by way of a final summary, the hypothesis for the pilot was proved, and some people were able to benefit, not everyone, but we know at least 5 people used the device to contact people during this pilot. We've got a few more who we need to follow up with and find out how they get on with that, and I'm going to update the slides as well. So although these will be shared out, I'll update the slides so that kind of we can carry that through once we find that out. We think we'd need to improve on communications between different partners, and really coming back to that one-to-one support was really, I think, what did make this successful for people. So that's something that would be good to kind of consider in terms of the sustainability of setting this up in future. Put links to all the resources that we used here. So feel free to use them. They should all be kind of publicly available. We barely have time. We've got -1 minute, so we don't really have too much time for questions now. Although if anybody does have any to pop in the chat, I'm happy to stay on a little bit. Or you can drop me an email. I'm more than happy to kind of cover questions there, or have an in-depth chat about anything that might be interesting. So thank you very much, everyone, for attending. And sorry we went a little bit over time.